Welcome to today's press briefing. We have with us two speakers. They are Head of the Communicable Disease Branch of the CHP, Dr. Chong Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Sarah Ho. We'll first hear from Dr. Chong. Good afternoon. Yesterday we had 116 PCR positive cases, 16 were confirmed by Hospital Authority, 19 by Public Health Laboratory source, and 81 confirmed by private laboratories. There are also 168 RAT positive cases. Total 284 positive cases. So far we have 1,195,116 positive cases in the fifth wave, including 747,658 PCR positive cases and 447,958 RAT test positive cases. In relation to 57 samples, we have conducted some genome sequencing analysis. They are all negative to L452R. There are 33 imported cases, 24 are PCR positive cases, 9 RAT positive cases, 10 were arrivals from yesterday. They were picked up at the airport over different flights. CX2883 cases, CH170, TR986, KL819, TK707, EK384 all had one case, and CX4952 2 cases. There are also 22 cases picked up at the quarantine hotel. They are samples between the third day and the sixth day, and there is a 12-day sample, 31-year-old male arriving from Thailand via Singapore, arriving on the 1st of May. On the 12th of May, a 12-day sample is positive. Previously, he had no positive record. In the same floor where he lived, there were no other positive cases. After he departed from the hotel, he went to the community. It was the CT value was about 17 to 18, so we think it's a local case, but we need to conduct full genome sequencing analysis. There is another BA.4 case. It's a 60-year-old female arriving from the US via Switzerland, arriving on the 9th of May, and she had sore throat on that day, and it was a case picked up at the airport. Altogether, we have BA.4, including this case, 3. There are no new cases amongst the care homes. Today, there is no school, so no new reported cases. In terms of death cases, the HA has reported another case, altogether 9,269 cases. So in the fifth wave, it's 9,147 cases. There is no special information in relation to other data. In relation to Sun Mon Club, there is an additional 6 cases. One is a staff member. Altogether, we have now 2 staff members. In the 6 cases, there are 2 staff members. One worked at the bar, in charge of food preparation and beverage. And this person on the 9th went to the A&E department because he felt unwell. CT value 17. On the 9th of May, he did not go to work. His colleague knew that he was positive, and he started coughing on the 9th of May, and he tested positive on the 11th. For the other 4 cases, there are people playing darts there, and we're still asking questions of the others. In relation to this cluster, we have 10 cases, 10 customers, and 2 staff members. In relation to Sky Cuisine, altogether we have 39 customers and 2 staff members that have been tested positive. 21 male and 23 females. Well, yesterday I made a mistake. I said the age range, the highest was 112. It was a mistake. For the 39 customers, some were just known. There are over 15 families. They were all sitting on the third floor. Actually, previously, the one that was on the second floor is actually from the third floor. There are about 20 or so, that is about 29 tables. Over half of the tables, that is 17 tables, have positive cases among them. There are some families that were all tested, family members that are all tested positive. There are some who live in West Terrace. That person started to feel unwell on the 11th of May. Under the restrictions and testing declaration, that case was identified. In relation to two of their family members, one felt unwell on the 9th of May. So we might have to conduct full genome sequencing analysis to see if Sky Cuisines related to West Terrace. In relation to others under the compulsory testing notice CTN, a lot of them are still waiting for results. In relation to environmental samples, we have obtained some. We have so far have two positive results. One in the male toilet. The other one is on the extractor fan of the female toilet. We suggest to the premises that a thorough disinfection, including a ventilation system, should be conducted. So far, for the samples we have obtained, that is the extractor fan of the female toilet, was positive. It shows that this virus is highly transmissible. It can be airborne. And we'll continue to follow up on other cases. That's all for my report today. We'll now hear from Dr. Ho. So far, we have 755 confirmed patients staying at hospitals and AWE, as well as Infection Control Center and Infectious Disease Center. We have no new cases of critical patients. 3 are in a serious condition, and there's 1 critical patient in ICU. We've reported 1 death case. It's a 77-year-old female who passed away yesterday. She did not come from a care home and was unvaccinated. So far, 106 patients have recovered, including 80 of them that have been discharged. In the 5th wave, we have 49,292 patients that have recovered, of which 48,771 who have been discharged. Since the beginning of 2020, we have 61,672 patients that have recovered, including 61,157 that have been discharged. There is 1 patient that was found to be tested positive upon admission. 1 patient in the same cubicles classified as close contact. So far, we have 25,856 staff members that have been tested positive. 22,703 of them have resumed work. Now the floor is open for questions. Use the microphone we give you and identify your media outlet. The lady at the back. I'm from TVB. The Princess Margaret Hospital said that there are long COVID symptoms amongst the pediatric patients who have recovered. Do you have relevant information? So how many of these children suffer from long COVID symptoms? How old are they? What are the symptoms? Have they been vaccinated? If so, why would there be long COVID symptoms? Does it mean that the vaccines are not effective? What arrangements will you make for them to get treatment? And what preparation do you have to deal with long COVID symptoms? What are manpower preparations?
pediatric doctors also said that the vaccination rate is only 70% for children. It is not ideal, and there is a concern there will be a 6th outbreak. So what is your view? Are you worried that there will be an outbreak? Are there any measures to boost the vaccination? Regarding some reports saying that we have 30 cases of children who recovered and have long-term COVID and multiple inflammation symptoms. So they have mentioned that for parents who are concerned, they should get their children vaccinated because there is data for vaccination that indicates it can prevent severe symptoms, and we've also conducted some investigation, and for patients with multi-system inflammatory system, they have not been vaccinated. So that's why we suggest having kids who have not been vaccinated get jabbed as soon as possible. For recovered patients, according to their clinical data, we will arrange for appropriate treatment and follow-up consultation. So kids who have not been vaccinated should get vaccinated as soon as possible. Now TV, regarding Singyut Lao, have you followed up on all the patients? And this had also had a previous outbreak. So after the outbreak, has there been any follow-up? Have you looked into the ventilation? And why do we have another outbreak in Sky Cuisine? So I want to ask the staff in East Terrace, are they a super spreader? Might there have been transmission from the toilets? So HA, will you also have consultation for children who have long-term COVID symptoms? What measures do you have aside from TCM for long-term COVID patients? There are some 200 people affected in Sky Cuisine, and looking at the records, most of them have been traced and they have conducted testing, but a lot of them are still awaiting for their results. I'm aware that FEHD has provided a lot of guidelines regarding ventilation in restaurants, so we cannot confirm that there is a super spreader or super transmitter in the West Terrace case. We need to analyze the data because that patient only develops symptoms at a later stage. Now, after being confirmed, the doctors will arrange for follow-up visits according to clinical data. So as you said, we do have some TCM services for recovered patients. So all patients, they can make telephone bookings and have follow-up consultation. Cable TV, I'd like to ask Dr. Chuang, the Sky Terrace, some 30 plus patrons were affected. So do we have an extra 39 today, or is it a total of 39? So what is the relationship between the patrons? Are they family members, or are they unknown to each other? Do any of them live in Saiwan Estate? Are there any connected cases? Now, you collected restaurant samples, so what are the lab results? Do the restaurants need to be suspended? Now, you also had a 30-year-old male, and he was active in the community. So where is his residence? Now, if it is a local case, then what is his travel history? Which places did he frequent? You weren't paying attention. We have a total of 39 cases in Sky Cuisine, 39 patrons and 2 staff. Now, I mentioned the environmental samples. We collected 40 plus, and 1 sample was from the male lavatory. Another one was from the female lavatory ventilation system. So this Sky Cuisine, we have told them to suspend operations because we have to wait for results. We have to wait for testing results, and there were a large number of patrons infected. So we need to wait for ventilation testing, the environmental samples before we give them the green light. Now, the 31-year-old male, just like other people, he has been active in the community. We have to wait for the DNA analysis to see whether it's an imported case or a local case. One, I'd like to ask Dr. Chong the situation regarding Sky Cuisine. We heard that the environment has some positive samples. Now, you said you suggested they disinfect the premises. So will their operations be suspended? And you said the cases were discovered on the 3rd floor. So what was the seating arrangement like? Were the patients concentrated in a particular area? And the Sunmong Club, the billiards club, you said they were playing darts. So are they related to the billiards players? Were they far apart, or were they infected by staff? And we also see that in Saiwan Estate, there are some cases, and the cases might be increasing. So is it risky there? The public there, do they need to be extra careful? Sky Cuisine, when we visited yesterday, we had told them to suspend operations temporarily. We have to collect environmental samples. We have to wait for EMSD to inspect the ventilation, to see whether they need improvement. And we'll have to consider all the factors before they give them the green light. The seating was on the 3rd floor, so the whole lobby had some 29 tables. All the cases have not been, we haven't been able to trace all of the seating arrangement, but we know that some 17 tables were affected. They were rather dispersed, and some tables were near the toilets. So I think the whole lobby area was affected, and if you look at the environmental samples, if you look at the ventilation samples, these are not typical areas patrons come into contact with, so there might be some air transmission. In Sunmong Club, there was one person playing darts. The other 3 people were still tracing them. We are still trying to locate the travel history on the 9th of May. There was a staff member at the bar area who was affected. A lot of people were playing billiards for a long period of time, and individuals were also drinking at the bar area, so they might not be all concentrated in one area. The people in Sky Cuisine, they were not living in Saiwan Estate except for the staff member. That's what I see so far, but we're still questioning the individuals. Saiwan Estate, in the quarantine notice, we hope to trace the individuals. We have cases throughout Hong Kong, and we have roughly 300 cases dispersed across the whole of Hong Kong and New Territories. So if people don't wear masks, you have to be prepared that you might get affected, especially in high-risk areas such as restaurants. So people should get vaccinated. In Saiwan Estate, if you look at the West Terrace, there were 22 cases in the West Terrace, and there were 9 people who were not vaccinated.
有成10個個案呢，都係
There are about 10 cases that were not vaccinated. Most of them are elderly people. So I do say that for elderly people, even if they don't go out, when they stay at home, or if they just go downstairs, there is always a chance of infection. So those who are unvaccinated or who haven't completed their course of vaccination should get vaccinated. All the cases are the 9th of May. The gentleman, I'm from Mingpao. First, Sunmong Club. I heard that there is a staff member for food preparation, started to feel unwell on the 9th. Is he the first person who fell ill? Is it the case that he infected another staff members and then the virus was transmitted? Have you conducted any genome analysis? What is your idea about a transmission route? In relation to Sky Cuisine, any chance of a super transmission? The 2 staff members, do they work on the floor, kitchen, or are they chefs? The EMSD paid a visit there. Have they identified any problems with ventilation? The male toilet sample, where was it taken? Any serious cases? Which cluster do they belong to? Have they been vaccinated? The one who fell ill on the 9th of May, actually, there were a number of cases that fell ill on the same day, so we don't know which one is the earliest. Most of these cases started showing symptoms on the 9th of May, but, they went there almost every day, say as early as the 5th and the 4th, but not all of them went there every day, but some went there quite frequently. Perhaps there was some kind of transmission before that, but there was an outbreak on the 8th or the 9th of May. We cannot identify the source of spread at the moment. We will try to see what information we can find. The 2 staff members of Sky Cuisine, they are waiters or waitresses. They work on the 3rd floor. The 2 arrivals on the 9th of May, we're still doing full genome sequencing analysis. We have not identified any serious cases in these clusters. But for these clusters, all the cases are covered by vaccine passes, so they should be fully vaccinated. Maybe that's why we have not identified any serious cases yet. The lady over here.
The South China Morning Post. The first, Dr. Zhang just mentioned that the oldest infected person at the Sky Cuisine restaurant in Shanghai is 97 years old, right? May I confirm with this age? And may I have more details about this case? Is this case the oldest patient so far? And is the person man or woman? What are his or her conditions now? Showing any symptoms? And how many family members and friends of this case have also been infected? Were they having dinner at the restaurant celebrating the Mother's Day at that time? The second is for the cluster in Sky Cuisine restaurant in Shangwan. Has this expanding cluster has raised further concern of CHP and posing infection risks in the community? And there are like 3 COVID clusters have emerged. And Dr. Zhang just mentioned the caseloads at the 2 clusters in Sky Cuisine restaurant in Shangwan and in the billiard center in Hongham. May I also have the caseload of the cluster in Saiwan Estate, please? And yeah, okay, thank you.
For the oldest person in the Sky Cuisine is 90 years old. So I made it wrong yesterday. So I apologize for that. And I do not have the details of the clinical condition of her, but during our interview, we know that her symptoms are mild, and she had dinner with her family members, and one of the family members is also a case. So for the Sai Wan estate, we have one more case according to our record in the West Sai Yun Toi. Yeah. So total there are 23 cases in Sai Yun Toi. So I forget about the second question. So we have around 300 cases in the community. There are definitely a lot of silent transmission in the community. So we only note those major clusters so we can take action, but we understand there may be a lot of transmissions through other routes. Yeah.
如果冇其他提問，今日記者會完結，多謝大家。
That's the end of the press briefing. Thank you.
新單位嚟㗎，
It's a new unit,
唔同嘅省嘅嚇。
a different one.